And welcome back. Well, it's fair to say that joint replacement surgeries are skyrocketing. In fact, about 300,000 Americans have a total hip replacement each year. 2 people here on set were talking about doing it just before this segment. And more than 700,000 will go home with a brand new knee. So today, the benefits of these procedures and the very latest advances. Dr. Stephen Merkow is with sports medicine, and Dr. Michael Tjarksen specializes in the spine at Orthopaedic Associates of Wisconsin. Thanks for being here, gentlemen.
Thanks for having us.
You're speaking to the masses, you know, today. I mean, there's people who are at home saying, I need a knee replacement, I need a hip replacement. They know that these are things coming in their future. Let's talk a little bit about traditional joint replacement surgery and kind of what that means in the hospital setting.
Well, actually, we're talking about in the outpatient setting, the 23-hour setting, and why things are moving towards that. But first I want to say that you know, my wife and I wake up every morning to Susan and Vince.
Aww.
And occasionally I pick up some of those recipes. It's just that it makes me a little bit too hungry. Now to the point we're talking about. But I think the reason things are moving to the 23-hour or outpatient setting is one of the ways we can do that is that they're more muscle sparing or lesser invasive. And an example is a hip replacement that's called an anterior approach, and I did bring a little model here to show. This is a hip replacement here. I don't know if you zooming
so that's a small version of a hip.
Yeah,
right?
and over here are the muscles, and we don't cut through them, but we go in between them.
So you can kind of just weave in them?
Yeah, weave between them, and it's less painful, and other advantages, there's likely less dislocations and things that we can be concerned about.
Was the traditional sense that people would cut through those?
Yes.
Gotcha.
A different approach. So another reason that we've is robotic assistance, which is helping with knee replacements, making them less painful and getting more active more quickly. And then I don't want to forget our anesthesia colleagues. They are helping us out a lot with these ultrasound-directed tiny catheters that they're placing and going right directed where around nerves that feed the area that we're surgically working on, and that's delivering a non-narcotic medication, so decreasing opioids, and we all know what's happening with that.
It's a crisis.
And one of the other reasons is that we're moving to this is because past several years we've been going to continuing with high quality care, but at a lesser cost for the medical world, and particularly with joint replacements in an outpatient setting or 23-hour, it's a lot less costly than the hospital setting, and we are, of course, keeping the patient in mind with safety. Only patients that are you know, more healthy without a lot of concurrent medical problems. So
well, I think that's what people want to hear. They want to hear that, yes, you're not just sending people home because it's easier for them, that their health is not at risk by going home. So the fact that the reason you're able to do that is because the advances in medicine, the ways that you're doing these surgeries are so much less invasive, and that the patient is able physically to be healthy recovering at home. Yeah. Do you find that people are having quicker recoveries as well with these new less invasive procedures?
Yes, I do, and it's all we've talked about it, you know, with my partners and colleagues, that it's all about their expectations as well. If a patient's expectation is that they will be going home later today or tomorrow morning, and they're prepped for these things by our family, our staff, you know, with physical therapy and with nursing and do's and don'ts, and you do a lot of uploading before, so there's no surprises.
Yeah. For you, Dr. Tjarksen, you work a lot with spines. That's what you do.
Yes.
How about spines? Is there truly an outpatient version of spine surgery?
There is indeed. We also do spine surgeries at the 23-hour facility that Steve referenced. Not the big procedures. Big procedures need to spend usually several days in the hospital. But the smaller procedures that are also generally skinnier, healthier patients that can get out of the facility within 23 hours we are doing there.
So someone may have a low back quick fix or something like that, that they're doing something that they're able to then go home that same day.
That's correct. The minimally invasive surgeries that have been developed over the years are less painful, less invasive. Obviously, those patients recover more quickly, and many of them go home the same day or the next day.
I found after surgery, one of the biggest things was also being able to have someone there with you, though, at home. And I know that's one thing that you guys probably talk about, is having someone at home, you know, whether it's caretaker or a friend or family member, just to help you with some basic things.
Yeah, well, it's always nice to have someone who cares, isn't it?
It is. Like, hey, can you help me just grab a water? That'd be fantastic. You guys are awesome. I think it's great that people can contact you, learn more about this 23-hour facility. You have a walk-in anytime, no appointment necessary as well. There's also the Ortho ASAP clinic for acute and new injuries. Here's how you contact the Ortho Associates of Wisconsin. It's orthowisconsin.com, or call it 262-303-5055 for Dr. Merkow and Dr. Tjarksen as well.